you wouldn't know it, but I am actually, I consider myself the more tech savvy of the pediatric orthopedic surgeons here at Memorial. I guess it's a low bar. Anyhow, so this is a quick presentation here about us here at MUN. We are a small program, and we are located, in St. John's, Newfoundland. I don't know if everybody's been here. I assume they have not. This is a map of, we are right here. So this little red arrow is pointing to the Avalon Peninsula of Newfoundland, which is where St. John's is located. So here's a blow up of the island of Newfoundland. And Labrador, of course, is part of our province as well, which is why we're now Memorial University and not MUN anymore, because we're actually the Memorial University of Newfoundland and Labrador. So our program is located in St. John's here, the most easterly point of North America. We see the sunrise first. The residents often see it before many other people. I show you this map here because I will bring up a couple of the other locations across the island that you may be familiar with. But people, one of the go-to questions we're always asked is, how long does it take to drive across the island? And how long is a ferry? So Evan, who's one of our residents here, PGY4, is also going to present. He recently did this drive, actually going to electives. So it's actually 10 hours across the whole island. It's about 900 kilometers. If you go up the Great Northern Peninsula, it's even more beyond that. It's almost a 12-hour drive. Then when you get to this west point here, that's when you get the ferry. You can take a shorter one as well, or you can just fly, which is what most of us do these days. You'll hear, around outside of the orthopedic world, you hear about the Newfoundland culture, and I think, that's something that is definitely heavily part of our orthopedic program here as well. I think some of those values and or kind of characteristics of the Newfoundland culture that people will kind of stereotypically think about, I do think they are reflected in that in our program. This is a snapshot of us from a few Christmases ago. This was actually like the first Christmas party after COVID. So everyone was very happy. Well, after the COVID lockdowns, we were allowed to have them earlier than a lot of other people because we were because of our geographical isolation, we were lucky in that life continued on in some ways differently than it did in other places. So although we're a small program, we still continue to grow. There's about 15 faculty here, 12 adult and 3 pediatric, and that's grown significantly like over the last 15 years or so. Between all of us, we have a breadth of experience. So we have, junior faculty who just started in September, and then we have people who are 30 years into their careers. So we have a nice breadth of experience, which is really good, both as trainees, but also as practicing surgeons as well. There's people here who've seen it all. We cover all the subspecialty areas, despite being small, kind of geographically and population wise. We are still the capital city of a small province, so we do have all the kind of resources at our hospital here that we would have in any other capital city. So all areas of ortho are covered, including some of the kind of ones that in some sites, like I've worked in another site across the country, and we didn't cover actually all of them. Some of the residents would go for rotations in other locations if we didn't do them, but here in St. John's, you can do all of them. And you will rotate through those. We have anywhere from 11 to 15 residents per year. And that really depends on what our allotment for CARMS is. Sorry, per year, I mean in total. So yeah, 11 for 15 total. We have 2 to 3 usually per year. This last year, we actually had 4. So it kind of depends on how many we get allotted each year. For 2026, we are allotted 3. So that's why you'll see the numbers change a little bit. In this residency program too, although you don't have to do it, but there is the opportunity to do a concurrent master's program as well, a master's degree as well. And I think Evan is working on that now, so he can speak to that if anyone has a question about that. In St. John, so these are pictures of our three main teaching hospitals. So this one here at the top is our tertiary level trauma center that's called the Health Sciences Center. Actually, the pediatric hospital, which used to be at a different site when I was growing up here, now for the last 20 years or so it's on the same campus as the adult, but it is a standalone separate hospital. And this is a picture of it here. So this is like a where the trauma goes to the adult side there. And then some of the other specialties of orthopedics will also be dealt with there as well. But that's where all kind of the high level polytrauma will be. This hospital here in the lower left-hand corner is St. Clair's Hospital, and that's kind of a more downtown type of hospital where lower acuity type orthopedics would be done there. And then at the Peds Hospital, of course, that's where anybody under 18 gets dealt with. And that, again, is a standalone hospital, which has its own resources, own operating room, doesn't share the board with any other adult services. And when the residents rotate through there, they just see pediatric patients and cover Peds call. So what do we do? So, I mean, like all the programs across the country, our goal is to produce competent and adaptable surgeons, community-based. Then, of course, if you want to go on and do a fellowship in any of these programs, you absolutely can. We, follow we're accredited program. We recently just came through accreditation last year. So a lot of the things that, we check all the boxes that all of the other programs will check. So we follow the competency by design principles. It's progressive clinical responsibility. We have longitudinal clinical exposure. You have the opportunity to have very close mentorship and early surgical exposure because we have we have more staff than residents. So they get to know you very, very well. You can't hide in our program. The nice thing is throughout that longitudinal clinical exposure, you will get to work with us over and over again. So it's not one of those things where you see us for like 2 months in third year, for example, and you never see us again. We have in our program, there's no fellows here in St. John's in orthopedics. So, fellows, absolutely. I was a fellow at one point, and I like to think I was a good resource to the residents. But because we don't have the fellowship level trainees, there's often not a lot of competition, so to speak, we'll call it, a friendly competition between senior residents and fellows for kind of the senior level type cases. So there, that's one thing that it may be different about our program as compared to some. We also have an organized teaching curriculum like all the other programs will have as well. So I'm just going to highlight a couple of the perks here at MUN that you may or may not have in other programs. So as I said, typically in the OR, you do have a 1-to-1 surgeon resident ratio. Occasionally there'll be a more junior resident or 2 seniors if there's a case that needs an extra set of hands or is particularly interesting. But most of the time it's 1 surgeon to 1 resident, so you get a lot of operative exposure at a very early date. We have significant travel and conference subsidy, which we have every year. It's about $2,000 a year. There's a specific research curriculum. You're expected to publish 1 study throughout the year. You can do more than that if you're academically inclined. And we do have a research day that I'll speak to in a minute, in which those are presented at. We have individual OrthoBullets subscription, which is a very good tool for organizing study. I'm not saying to only study the OrthoBullets. Certainly that's not enough to study, but in terms of organizing topics, and also there's practice questions and so on, that becomes quite useful. And we've received good feedback from our senior residents about that as they move through. We do have Precision OS. We have a subscription. We are early in the days of using that now, so it is not a formal part of our curriculum at this time. Definitely, I'd like to explore how that is happening. I recently attended kind of a roundtable type of conference call about how this will be, useful to programs in the future. It is coming regardless, some form of virtual training adjuncts, but that's not a formal part of our training right now, but we do have them. We have tactile orthopedic arthroscopic models for simulation, and we do some of that within our boot camps. All the residents get a personalized lead apron, Traditionally, that used to be in the kind of senior years, but now we're kind of revamping that to get it in your junior years when it really matters most, that you start having it right from the beginning. Because we are a significant, we have a significant rural component to our province. We do have a community rural rotation, and these would be like quite rural, quite community based. Not the type of community hospitals that you would see in some of the larger centers. There is definitely the opportunity to go to other centers outside of Newfoundland if that's what someone wishes to do. We've definitely had people go to like parts of BC, parts of PEI, New Brunswick, Nova Scotia, Ontario. So there is opportunity for that as well. And then we do have a night float system, which I will speak to as well in a minute. So our formal teaching curriculum, I'm not going to spend a whole lot of time on this other than to just say that we have a lot of these because I don't think, it's much different than many of the other programs you'll hear. I think it's standard these days to have a boot camp for your junior residents. And we certainly have that early in first year. And we actually have the second years go through it again as well. And that's an opportunity for them to kind of brush up on anything that they feel they didn't really see or do. And also it's an opportunity for them to teach their juniors some things the junior first years to them, what they've learned kind of in their first year. So it's a nice mentorship opportunity as well for the first years. We also, like Saskatchewan, don't have a academic half day. That is kind of by design. We have, again, floated that idea recently to our program training committee. And we continuously reevaluate how our curriculum is laid out kind of logistically. But right now the residents are happy with this plan that we have now where it's spread out. So we have weekly trauma, weekly pediatric, and then a grand rounds topic. And the grand rounds topics are resident focused. They're a combination of resident and staff led, and they have a rotating schedule every couple of years, and it covers all of the other subspecialties that aren't covered in the trauma and the grand rounds. We also have an annual anatomy teaching block, which is a cadaveric-based program as well. This is over the span of a couple of months. And we also have a new initiative this year in which we're going to have a component of some trauma teaching with the cadaver as well for ex-fix principles and so on, amongst other things. We have a visiting professor lecture series, which was a relatively recent initiative. We've always had visiting lecturers, but this is kind of a formalized series that now we have 2 to 3 times a year for different types of medical experts in orthopedics, but also we've had some speak to the non-medical expert surgeon roles as well, which has been quite good. Like last year we had someone come and present he gave a grand rounds presentation, then he presented on the residents on how to do an interview, which was quite well for fellowship and beyond, which was quite well received by the residents. It was very interactive and good. So we've had a couple of those. Journal club, we have monthly, and we have that at our houses. So the staff rotate houses. It's actually pretty fun time. It's we occasionally have an industry sponsored one every now and then, like once a year, if that. But for the most part, we do it at the staff's house, and the staff either cook or have it catered or something like that. So that's very enjoyable. And then the other things, we have robust oral preparation. One of the staff starting in 5th year has 5th years over every Thursday night for the whole year, cooks some supper, has a glass of wine, and then they prepare for the exams. So that starts very early. And that's also a very, I would say it's a pretty special thing that the residents really, really like all along their residency. And so these are just some pictures of some of these things that I have brought up. This is in our orthopedic, or sorry, I should say in our clinical skills lab. This is our brand new first years here, and one of our first years here and second years Adel here in their boot camp recently. These are our third years with our former program director, Dr. Au, at I think this one is at the AO course, I think, can't remember. And this is one of our guest lecture series recently as well. These are our graduating residents from last year. They receive a piece of artwork done by one of our clinic staff here. And that we have a big party at the end of the year every year for a graduation party. And that also rotates at the staff people's houses every year. So our clinical rotations, we have them spread out between, we have mostly the off-service blocks are in year 1 and year 2. I would say these are changing a little bit year to year. We recently changed one of them, but we have 4 blocks of off-service in year 1, and then in year 2 we do neurosurgery and ICU. We actually do plastics in year 3 here because we have a pretty robust hand and upper limb plastics program, and they don't have plastic residents here. So the residents get more out of that rotation if they do it earlier, and that's kind of, later, which is why that's it's a kind of a bit of a late time to do an off-service rotation, but that's by design. And again, we've gotten good feedback both from the residents as they get to do a whole lot on that rotation, which is very specific to orthopedics and plastics kind of intersection there. In 4th year, there's 3 blocks of electives. Oh, and in 3rd year, sorry, I forgot, there's 3 blocks of community orthopedics. And then in 4th year, like I said, there's 3 blocks of electives. We do have approximately 1 block of night float a year. That's a program that's been ongoing now for 3 or 4 years. The residents love it. There may be some changes in that with resident numbers, because if we have more residents than blocks, or less residents and blocks, they won't have that may change a bit. But basically what it means is that Sunday night to Sunday night to, I always mess this up, to Friday morning, there's night flow coverage Sunday to Thursday night, and then on the weekend the residents on service will typically cover. So between 5 p.m. and 7 a.m. on Sunday through Thursday nights, the residents who are assigned to daytime duties don't have to cover those nights on call. The night float resident does that. So they only are responsible for the weekends, and that is, quite a big difference for them. So there's no need to worry about post call, about losing academics during that time. And the night flow residents are, they're busy. They get to operate a lot overnight. So it isn't just a rotation of seeing consults and doing kind of work that you're not, as you move along, you're still learning from it because you're still doing significant amount of operating and so on in the evenings. So what else do we do? We hold fast to our culture. We like to have parties. This is our year-end party. This is a team of our staff who actually competed in the regatta. This is an older picture, but they competed as a rowing crew. This is one of the older sporting events in North America. I can't remember exactly how old it is, but it's well over 100 years old. I should know that. I'll know by the end of this. Anyways, it's a rowing regatta that happens all day long. It's a big event. It's actually a rotating holiday. We do have an annual resident retreat where there's very formal activities. It is generally held at one of the staff people's cabins as well. We don't have cottages in Newfoundland. We have cabins. And we too do paintball. However, we don't always do that. This was one year. We also just drink in hot tubs sometimes. And we also go out on the boat and go water skiing and play some cornholes, things like that. That was this year's. One of the staff tries to take the residents out cod jigging at some point during their residency. And this is a cod jigging that occurs, and then you basically do a fish fry afterwards and eat your fish that you've just caught. There's lots of outdoors enthusiasm here. These are, the pictures you'll see on those beautiful tourism ads. This is the west coast of the island. It's an inland former fjord in Grossmoor National Park. This is 10 minutes from where I sit. This is just down the road from my house. This is in downtown St. John's. This is the old fishing heritage area of St. John's. And this is, if you've ever been to St. John's, that's right in the harbor. So you can walk, like if I left my house right now in 10 minutes, I could walk along this area right now. I wouldn't want to in the cold and the dark, but Okay, so I'm going to hand it over to Evan to quickly go through some of the resident perspective.
Can everybody hear me okay? Perfect. Yep, so I'm just going to give a quick rundown from the non-program director perspective. So we, if you want to just flick back to the last slide.
Sorry, that's not far. Yeah, sorry.
Yeah, no worries. So a lot of the programs that you'll hear kind of these sessions from will talk about how you get a lot of early operative exposure. In our case, that is actually true. You're either the first assist in the OR for very complex cases or the more routine cases within the first few months of residency. You'll be primarily doing those with varying levels of assistance from the staff. As Dr. Cashin mentioned, you don't have any fellows in Newfoundland to compete with, so the cases are all yours to do as much of as you can. You don't have to worry about playing second fiddle to a fellow who's going to come in and swoop the case out from under you. As a smaller program, the resident group is quite close. We're more than just coworkers, I would say, on an almost weekly basis, sometimes multiple times per week basis. There are kind of out of work gatherings with some or all of the residents, and that could be any number of different activities. There's pretty routine. They were meeting up for Friday evening beers after the last clinic is over, so that's a long-standing tradition as well. A lot of the teaching that's done, certainly on a ward level, but also we do have scheduled Friday morning teaching that is resident-led as well. So as I'm kind of transitioning into the senior resident role, it's nice to pass on the things that I've learned to the more junior residents, much like was done with me. And so there's a lot of perspective you can gain from formalized learning from the residents themselves that the staff don't necessarily have that same context, where they're not in the trenches as much, so to speak, as we are. There is lots of formal teaching as well. We have I think a rotating 2-year schedule for grand rounds on all manner of different topics, orthopedic and otherwise. And we do have a very high success rate with passing the Royal College exam. I can't remember the last person that had any trouble with it. If you want to switch the slide there. Perfect. So outside the program, St. John's is a medium-sized city. Population is just over 100,000. The metro region, with the surrounding large towns and cities around St. John's, has a total population of only about 250,000. So it's not a huge area, but with that small size means that everything that you could want is within a short drive. There are no traffic jams to contend with. I can get home from either hospital at a 15-minute drive at most, which is great compared to some of the bigger cities. Yeah, that's probably a lot farther than some. Both the hospitals are within 10 minutes of each other, and that's a great point for night float coverage when you do often have to bounce between sites. You can get to the other hospital and be from one emergency department to the other in 10 minutes or less, which is great. If you're into outdoor activities like skidooing, hiking, fishing, this is absolutely the place for you. And of course, Newfoundland, I think, has a long-standing, well-known reputation for being very friendly. And if you get to spend any time here, you'll quickly realize that, I think. We do have some remote learning opportunities as well. We have some traveling clinics that go well up north to Goose Bay and Lab City. So typically you'll fly up with the staff member who's asked you to go with them. And you'll do probably a couple of days of heavy duty clinic there. And then, you'll fly home right after. But during that time, you have a lot of independence to see patients at, ideally a fast pace and make your own decisions. We do have opportunities to travel to some of our more peripherally located ORs in Carbonear and St. Anthony. Um, and they're a great opportunity to get used to a different hospital environment as well. We also have some international missions that we go on. Team Broken Earth, which is now an internationally recognized medical charity, was actually founded by one of our surgeons here in town and our former premier, actually, who's now stepped away from office and stepped back into the operating room. So we've had residents go with staff on missions to Haiti, Bangladesh, Nicaragua, Guatemala. Last April, I actually went with one of our staff people to Ecuador, where we did a mission with Operation Walk, focusing on a lot of DDH hip cases, which was absolutely incredible. And as a senior resident, you'll often have the opportunity to go on one or more of these trips during your years here. So overall, I think Newfoundland is a great place to spend 5 years, even if you haven't been here before. I've never heard of anybody leaving Newfoundland disappointed. We have a lot of hands-on practical teaching and a lot of operative exposure. You won't hurt for any exposure to anything after your 5 years here. The faculty are all quite committed to training high quality surgeons. And while they're doing that, we have a great time. So it's been an excellent 4 years, or well, 3 and a bit years thus far. So I would strongly recommend it to anybody.